Which component of the CPB circuit is considered the artificial lung where gas exchange actually occurs? A. Roller pump. B. Venous reservoir. C. Membrane oxygenator. D. Arterial filter. Answer: C. Membrane oxygenator. Explanation: the membrane oxygenator is the component responsible for transferring oxygen into the blood and removing carbon dioxide, effectively replacing pulmonary function during bypass. Modern membrane oxygenators use hollow fibers to separate the blood and gas phases, minimizing blood trauma. What is the primary advantage of a centrifugal pump over a roller pump in a CPB circuit? A. It is completely non-occlusive and reduces the risk of massive gaseous microembolism if the venous reservoir runs dry. B. It delivers a strict, constant volume regardless of downstream afterload. C. It does not require a flow meter to measure output. D. It is significantly less expensive. Answer: A. It is completely non-occlusive and reduces the risk of massive gaseous microembolism if the venous reservoir runs dry. Explanation: centrifugal pumps operate via magnetic coupling and kinetic energy, constrained vortex principle. Because they are non-occlusive, if the venous reservoir empties, they cannot generate enough negative pressure to pull massive amounts of air into the arterial line. However, their flow is dependent on preload and afterload, unlike the positive displacement roller pumps. In a standard CPB circuit, where is the arterial line filter typically placed? A. Between the venous cannula and the venous reservoir. B. Before the oxygenator. C. Just before the blood enters the cardiotomy reservoir. D. After the oxygenator, right before the blood returns to the patient. Answer: D. After the oxygenator, right before the blood returns to the patient. Explanation: the arterial filter acts as the final safety barrier before blood is reinfused into the patient's arterial system. It typically features a 20 to 40 micrometer mesh designed to trap microemboli, gas bubbles, and cellular debris that may have escaped the oxygenator. Which monitoring modality is most critical for detecting regional cerebral hypoperfusion and ischemia during CPB? A. Electrocardiography, ECG. B. Near-infrared spectroscopy, NIRS. C. Central venous pressure, CVP. D. Pulse oximetry on the finger. Answer: B. Near-infrared spectroscopy, NIRS. Explanation: NIRS provides real-time, continuous monitoring of regional cerebral tissue oxygen saturation, RSO2. Because pulse oximetry is unreliable during non-pulsatile CPB flow and hypothermia, NIRS is invaluable for detecting unilateral or bilateral cerebral hypoperfusion due to cannula malpositioning or low flow. Why is the venous reservoir positioned below the level of the patient's heart in a gravity drainage CPB circuit? A. To prevent arterial air embolism. B. To create a hydrostatic pressure gradient that facilitates blood flow out of the venae cavae. C. To ensure the cardiotomy suction works efficiently. D. To cool the blood before it reaches the oxygenator. Answer: B. To create a hydrostatic pressure gradient that facilitates blood flow out of the venae cavae. Explanation: passive venous drainage relies entirely on gravity. Positioning the venous reservoir roughly 40 to 50 centimeters below the level of the patient's heart creates a hydrostatic pressure column, siphon effect, necessary to draw blood smoothly from the central veins into the circuit. What is the standard pore size of a cardiotomy/venous reservoir filter used to handle shed mediastinal suction blood? A. 1 to 5 micrometers. B. 20 to 40 micrometers. C. 100 to 150 micrometers. D. 500 micrometers. Answer: B. 20 to 40 micrometers. Explanation: cardiotomy filters are designed to aggressively filter out bone fragments, fat droplets, tissue debris, and microclots from shed surgical field blood before it mixes back into the systemic circulation. A pore size of 20 to 40 μm balances efficient filtration with acceptable resistance to flow. During CPB, a sudden, sharp increase in the arterial line pressure, measured between the pump head and the oxygenator, most likely indicates A. A kink or obstruction in the venous drainage line. B. A kink, clamp, or dissection in the arterial cannula/line. C. An underfilled venous reservoir. D. Severe aortic valve regurgitation. Answer: B. A kink, clamp, or dissection in the arterial cannula/line. Explanation: the pressure measured immediately after the pump head reflects resistance the pump must overcome to push blood into the patient. A sudden spike in this pressure points to an obstruction downstream of the pump, such as a clamped arterial line, a kinked cannula, or an aortic dissection caused by cannula. Which of the following statements regarding the heat exchanger in a CPB circuit is correct? A. It is located downstream of the arterial filter. B. Water temperature inside the exchanger should never exceed blood temperature by more than 10 degrees Celsius to prevent protein denaturation. C. It uses direct mixing of sterile water and blood. D. The water temperature should not exceed 42 degrees Celsius during rewarming. Answer: D. The water temperature should not exceed 42 degrees Celsius during rewarming. Explanation: to prevent the destruction of plasma proteins and hemolysis, the temperature of the water inside the heat exchanger must never exceed 42 degrees Celsius. Additionally, the temperature gradient between the water and the blood should not exceed 10 degrees Celsius during rewarming to prevent dissolved gases from coming out of solution and forming microbubbles. What is the purpose of the level alarm on the venous/cardiotomy reservoir? A. To signal when the patient's hematocrit is too low. B. To prevent the reservoir from running completely dry and introducing massive air into the pump. C. To monitor the volume of cardioplegia delivered. D. To sound an alert when the oxygen cylinder is empty. Answer: B. To prevent the reservoir from running completely dry and introducing massive air into the pump. Explanation: if a reservoir runs dry, a roller pump will rapidly pump air directly into the patient's arterial system, which is a catastrophic event. Level sensors/alarms are vital safety devices that alert the perfusionist, or automatically stop the pump, when the blood volume drops below a safe threshold. Which type of material is primarily used in modern hollow fiber membrane oxygenators to separate blood from gas? A. Silicone rubber sheets. B. Polypropylene or polymethylpentene, PMP. C. Latex membranes. D. Cellulose acetate. Answer: B. Polypropylene or polymethylpentene, PMP. Explanation: modern oxygenators utilize microporous polypropylene or true solid membrane polymethylpentene, PMP, hollow fibers. PMP is particularly favored in long-term support circuits, like ECMO, because it prevents plasma leakage across the fiber membrane over extended periods. Continuous inline blood gas monitoring, CDI, on a CPB circuit directly measures which set of parameters? A. Activated clotting time, ACT, and fibrinogen levels. B. pH, PCO2, PO2, and SO2, plus temperature and hematocrit. C. Platelet count and factor VIII activity. D. Cerebral blood flow velocity and intracranial pressure. Answer: B. pH, PCO2, PO2, and SO2, plus temperature and hematocrit. Explanation: inline CDI monitors use optical sensors or fluorescence chemistry to provide continuous, real-time measurements of blood gas values, pH, PCO2, PO2, oxygen saturation, SO2, hematocrit, and temperature, reducing the need for frequent manual blood gas draws. If a perfusionist notices an isolated drop in the venous oxygen saturation, SpBO2, to 55% during CPB, what does this most likely signify? A. Excessive CPB flow rate relative to metabolic demand. B. Inadequate tissue perfusion or increased systemic metabolic demand, hypoperfusion/hyperthermia. C. An overoxygenated circuit. D. Severe hemodilution without tissue oxygen extraction. Answer: B. Inadequate tissue perfusion or increased systemic metabolic demand, hypoperfusion/hyperthermia. Explanation: normal mixed venous oxygen saturation, SpBO2, during CPB is typically kept above 65 to 70%. A drop to 55% indicates that the tissues are extracting a higher percentage of oxygen because total oxygen delivery, due to, is failing to meet metabolic demands, often due to low CPB flow, low hemoglobin, or inadequate anesthesia/muscle relaxation. What function does the bubble detector serve on the arterial line of a CPB machine? A. It quantifies the amount of CO2 being eliminated. B. It uses ultrasound to detect macroscopic air bubbles and automatically clamps the arterial line or stops the pump. C. It regulates the volatile anesthetic vaporizer. D. It measures blood viscosity changes. Answer. B. It uses ultrasound to detect macroscopic air bubbles and automatically clamps the arterial line or stops the pump. Explanation. The arterial line bubble detector is an essential electronic safety override. It uses ultrasonic waves to detect the presence of air bubbles in the fluid line. If a bubble is detected, it triggers an acoustic alarm and instantly halts or slows the arterial pump to prevent systemic air embolization. Which statement accurately describes the mechanism of vacuum-assisted venous drainage, VAVD? A. A roller pump is attached directly to the arterial cannula to suck blood out. B. A regulated negative pressure, vacuum, is applied directly to a sealed venous reservoir to augment drainage. C. It utilizes a high-pressure jet stream to force venous blood down. D. It eliminates the need for an arterial filter entirely. Answer. B. A regulated negative pressure, vacuum, is applied directly to a sealed venous reservoir to augment drainage. Explanation. VAVD involves applying a regulated vacuum, usually between -30 to -60 mm of mercury, to a sealed hardshell venous reservoir. This safely augments venous drainage, allowing for the use of smaller diameter venous cannulas, which is especially useful in minimally invasive cardiac surgeries. Why must a purge line be kept open on the top of the arterial filter during CPB? A. To allow continuous administration of cardioplegia. B. To sample arterial blood gases without stopping the pump. C. To continuously divert any small air bubbles that get trapped in the filter back to the venous reservoir. D. To vent the left ventricle. Answer. C. To continuously divert any small air bubbles that get trapped in the filter back to the venous reservoir. Explanation. The arterial filter is designed so that air bubbles naturally rise to the top of its housing. A small, continuous purge line connects the top of this housing back to the venous reservoir, ensuring that any microscopic or macroscopic air trapped by the filter is immediately evacuated away from the path leading to the patient.